Hi, I'm Dr. Jacqueline Chassie, and I'm so excited about the March 31st webinar that we're hosting on integrative and naturopathic approaches to infertility. Now, you might see infertility patients in your practice, and I'm sure through applying what you've learned in naturopathic school and functional medicine programs that you're really skilled at working with these patients. But this webinar, this full day webinar, is geared to bringing you to the next level. What we're going to be covering is preconception care, men's and women's infertility of nearly every origin, and then also talking about recurrent miscarriage and recurrent pregnancy loss, so that you're better able to serve that population too. Just to give you a couple examples of how this webinar might help you better in your practice, I'm going to give you kind of 3 examples. So the first is lab assessment. This is the area that in all of my classes, whether it's an introductory class or an advanced mentorship program, this is the area that doctors request the most. Looking at labs, understanding how to interpret them, and how to use them to drive decision making. We're going to talk a lot about this, and I've really scoured the research so that and I'm going to give you the resource as you see as a bonus material, so that when you are reading labs, you're not just using a lab normal range, which is kind of bland, but you're using the ranges that are appropriate for infertility patients, so you can really see exactly the right window that they should be in. And when things are outside of those ranges, why that might be happening. Let me give you an example. Thyroid health. Every patient for infertility, every woman should be screened for thyroid health when she's trying to get pregnant if she's having difficulty. The reason for that is that the thyroid normal range thins pretty substantially when a woman's trying to get pregnant. What we see in the literature is that women whose TSH moves above 2 actually have a significant increased difficulty in falling pregnant. And if you use a lab normal range, or even just your own learning, lab ranges can be like upper limit of normal is like 4 to 10. But if a woman's even at 2.5, the lab certainly won't flag it. And if you didn't work on infertility, you'd think, well, that's probably okay. But no, you need to get that patient lower. Same thing with thyroid antibodies. Anti-TPO antibodies, we know that low levels are not necessarily problematic, right, within a euthyroid environment. But with a woman's trying to get pregnant, if she has any elevated thyroid antibodies, even if her TSH and thyroid function are normal, that can hinder infertility in a totally different way. And so we're going to talk about what that means and how to treat a woman that experiences elevated thyroid antibodies. So on top of labs, the next thing we're going to talk a lot about is stress. And I think we all know stress causes infertility, but this has been my kind of clinical area that I've been like really diving into and getting juicy with, because it's an area I find it much more difficult to work with patients on, other than like, yeah, you should do some stress reducing things like walk and, sleep enough and things like that. But what are the tools and tricks that can actually help your patients change their behavior? And what are the right ways for them to change their behavior to actually impact their fertility levels? Now, the third example I want to give you is in the world of poor egg quality. Now, that's probably the biggest reason why at least women come in to see me for infertility. Many of them, they're either older, and so they're experiencing a natural decline with aging that they want to try to reverse or pause so that they're able to conceive. And the second is a premature decline in ovarian reserve. Ovarian reserve is the ability of the ovaries to do their job and make healthy eggs, basically. Now, fertility clinics can run this. You're going to learn how to test for it. But when the labs come back, fertility clinics stop there and they say you have poor egg quality. That means we either need to do IVF or you need an egg donor, right? But what you're going to learn in this webinar is actually how to dig deeper to understand why. Because there are actually 5 drivers for egg quality to decline. 5 main drivers. There's a couple more, but 5 main drivers. So I'm going to help you learn what labs you can run to figure out which of those drivers are part of the root cause for that particular patient. That allows your treatment plan to be more effective and more targeted. And when you're working with patients for fertility, they typically need a lot of supplementation. You don't want to have to give them everything for everything because it's overwhelming. It's just too much. And it's expensive, and they don't want to swallow that many pills. So you really want to refine to the highest priority nutrients and things that are actually going to really help them and have a return on that investment they're making by buying the product and taking the pills. So those are 3 examples. I could give you 100 more. I'm super excited for this, and I really hope that you're going to participate. You can find out more about the webinar by visiting perfectfertility.com/webinar. That has all the detailed information. There's a ton of bonus material that I've never offered before, but I'm basically like opening up my files and giving you all of the most juicy, helpful resources that I use every day in practice. And there you'll find more information and a link to register. I hope I'll see you on the webinar, and whether or not I do, keep doing the good work you're doing, but I hope you join us so that we can work together and make some healthy babies. All right, thank you. Nice to talk to you, and see you soon. Bye-bye.